On a Facebook group, a lady asked recently when to consider surgery. And my answer was, well, there are two main cases. Case number one, the situation is unstable. For example, from one moment to the other, you could have a severe spinal cord compression. Well, if so, the consequences are so dramatic that you should go for surgery, even though there are side effects or potential side effects to surgery. Situation number two is, well, when you have tried everything. But there is a trick. Most people mix up I have tried everything and I have tried everything I know. There's a big difference because by experience, speaking to clients, patients and others, well, everything you know is usually what I call hands-on approaches, which are someone doing something to you. Acupuncture, osteopathic, chiropractor, physiotherapy, you name it. Yeah? And there's one field which is very, very often disregarded, is what you do to yourself, i.e. your habits. And this is what I call posture and ergonomics therapy. Yeah. My answer was therefore, well, make sure that you have tried before a full posture and ergonomics program. Let's see what this means. Well, the basic philosophy underlying posture and ergonomics therapy is to say, well, there are only two ways to hurt yourself. One possibility is you have an accident. If so, the causes belong to the past, so focusing on the symptoms is good enough. Therefore, hands-on therapies will do the job no problem. The other possibility to hurt yourself, so to say, is a slow phenomenon which we call cumulative disorders. Most cases of pain, hernia or whatever you want, and even degenerative diseases are due to overuse, even if they are, say, in a genetic context, which you cannot change, If you would have, say, less overuse, things would have happened less early, less severely. My job is to deal with overuse, not really with accidents, but sometimes there's a bit of an overlap. Say, for example, often you see that, the accident will be the last event that triggers overuse. Or that due to the accident, I limp, and this will create overuse. But let's focus on the simple case, which is just overuse. Overuse is like the glass that gets full and that overflows. Okay? The glass can be anything you want, can be your elbow, your neck, your body as a whole, depending on the clinical reasoning that we're trying to have. In the glass model, there are three parameters. The tap is what you do to yourself. Yeah? It's the load that you put on your tissues. The straw represents how you remove the load, and the glass represents what the WHO calls the load-bearing capacity, i.e. how much your tissues can take. Yeah? Posture and ergonomics will strongly be involved in the tap, is what you do to your body, consciously or not, willingly or not, plus what the rest of the world does to your body, consciously or not, willingly or not. The first one is posture, the second one is ergonomics. Posture, as I define it, is what you do with your body, willingly or not, consciously or not, 24/7, with every muscle and joint of your body. Yeah? Therefore, it is also the straw. By definition, the straw is what you do to your body. But there are other things that we can use as a straw, such as heat pack, such as stents, such as meditation, such as warm bath, such as massage, etc. You name it. And the size of the glass is due to your medical condition, i.e. everything you cannot change anymore, including your genetics, your physical condition, and your psychological condition. So here again, posture plays a role. Okay? Now, say for example, sports can be a bit of everything. It is a tap because it loads your tissues, it is a straw because it makes you feel good, and it is something that increases the size of the glass because, well, it's linked to a better load-bearing capacity. So, the model does not say that everything you do is either one or the other. It can be a combination. Basically, what you need to understand is that the glass will get full and overflow if through the tap comes more load than you take out through the straw. Hence, what I call a full posture and ergonomic strategy is this what you see now, which is a full strategy, short, medium, long term, to 1. Close the tap, 2. Increase the evacuation with the straw, 3. Later increase the glass capacity. And that will be regarding what you do with your body 24/7. That includes work, home and hobbies. And by experience, most therapists and people neglect all these aspects, whereas they are the true cause to your pain. The true cause to your pain is not the fact that you have a hernia. The true cause of your pain is, why the hell do you have a hernia? A hernia doesn't come just like this by chance. You wake up or I give you a kiss and you get a hernia. No, a hernia is not contagious. A hernia is because you misused your disc. Therefore, the causal treatment is restore a healthy way to use your disc in this case and your body as a general treatment.